Have you ever worried about slipping in the bathroom or helping a loved one get up safely? You need to know about Safety Grip. Unlike outdated smooth metal grab bars, Safety Grip has a unique textured design that gives a better grip and more control, especially for those with weak or tired hands. It looks great, feels secure, and installs just like a regular bar. Visit heartmobility.com to learn more.
Welcome to the Aging Together podcast. I'm your host, Dr. Pooja A, Patel, an occupational therapist with board certification in gerontology and additional specialty certifications in dementia and fall prevention. In this podcast, I interview guests who are experts in their fields and caregivers who share their lived experiences. Let's meet today's guest. Hello, everyone, and welcome to a live stream of the Aging Together podcast, Season 4, sponsored by Heart Mobility, revolutionizing those steel metal gray grab bars from the 1960s with their newest product, Safety Grip. Today's guest is Alfred Poor, the HealthTech Futurist. Alfred is a dynamic speaker and virtual event expert with an international reputation in technology fields. He was the editor of HealthTech Insider, a website that covered wearable and mobile devices for health and medical applications. A graduate of Harvard College, he is the author or co-author of 15 books and is widely quoted in major media outlets. He brings energy and humor to his presentations and tailors his programs to match the technical levels and interests of his audience. Alfred, thank you so much for joining me today.
Well, thank you. I appreciate the invitation.
Absolutely. So you've built an incredible career at the intersection of health, tech, and human connection. What first drew you to the world of health technology, and how has your why evolved over the years?
So, I won't start off with, I started off as a young boy, but I did, straight out of college, I did teach science, middle school science for a short while. Realized I enjoyed teaching, but not in the classroom. That wasn't a good fit for me. And I ended up doing writing, and initially writing about technology, initially about personal computers, which were new on the market at the time. And after 20 some years of writing about that market sort of became a commodity and people were less interested in it. So I started writing about displays and had a good 5-6 year run covering those. And then thought, what's the next big bang? What's going to make the big difference in people's lives? And I thought it was going to be wearable technology. And a friend of mine offered me the opportunity to start a website and newsletter about the health and medical applications of wearable tech. A couple years later, he had enough fun, I bought it from him. So that ran for 9 years. We published over 3,500 articles. Basically, my goal has always been to take complex ideas and explain them to people in ways that they can put them to use. And I felt that especially with this wearables and health tech kind of field, because fundamentally, we don't have enough money to deliver healthcare the way we need to in this country and worldwide. And we don't have enough people, no matter what the training level, from physician to technician, support staff, all the way up and down the chain. We just don't have enough people. And we're not going to get more money, and we're not going to get more people. So that for me, the only way out of the box is technology.
Yeah, you're so right about that. When you launched HealthTech Insider and began covering these wearable and mobile health innovations, what was that gap that you were hoping to fill? Because I imagine there's countless magazines and newsletters and websites, and there had to be something there that was missing.
So two things were missing. One was most of the people who were interested in covering wearables were covering gadgets. It's the cool stuff, the watch, the whatever, and it was less about solving problems. And the other part that was missing was context. A lot of the people who write about these things don't have the technology background to understand what's a substantial claim of something that's going to be an improvement and something that's smoke and mirrors. And in fact, the HealthTech Insider was really aimed at businesses. We had a large consumer following, readership, but my main goal was to help people in the business know what's going on and be aware of other stuff that might impact how they approach the problems they're trying to solve. I used to go to CES every year, and I would end up talking with C-level executives from at least 100 different companies, from the major international, multinational corporate people down to little university labs and that spin-offs and those kinds of things. And one thing that really surprised me was whether you're working for Merck or Johnson & Johnson or Abbott or one of these giant companies, or working with a little startup here in Philadelphia, the problems were the same. Pretty much you're digging a hole and your main job is to focus on digging that hole, and you really don't have time to look outside the hole and see what is going on around you. And so I felt that was my job, is to sit there at 10,000 feet and look into all the holes and say, this is what's going on. And my favorite story about that was at CES one year. I met this woman who was creating an insole to go inside your shoe with sensors in it. And it was designed to help elderly people with gait issues to analyze their gait and help analyze the risk of fall detection, that sort of thing. But she said, I've got this problem. We've got this thing, but we need to put this big coin battery in it someplace, and we can't find a place to put it where it doesn't hurt the person's foot. And I said, well, if you got time, the booth that is literally on the other side of the curtain at the back of your booth, they're making flexible batteries. So you might want to go talk to them. So that's sort of like I'm a connector by heart. And so that's sort of the spirit behind all that I was doing with that site.
That's a great story. Thanks for sharing. It's really is neat when you can connect two people who could benefit each other or work together in some capacity to advance a product or a mission or whatever it might be. And that's awesome. Do you remember what the first, so when you were writing these articles for HealthTech Insider, were you focusing in on specific products, or were you kind of giving 360 overviews of the types of products or categories of products?
Good question. So we always started with the specific. So maybe it was a new study that came out, or a new product, or a new technology that's being made available to the industry or something like that. But so it was, here's what's happening. Here's why it matters. Here's what difference it could make. So, we would start with the specific and then blossom out from there to give you the full context to help you understand how this, could make a change. I mean, one of my favorites on that was a lot of children were born with malformed hands and can't grasp things, and it's loaded. And there was a father who was in someplace like the Netherlands and had a daughter with this condition, and a guy who was in South Africa and was beginning to experiment with 3D printing. They emailed back and forth, and the guy in South Africa designed a mechanical hand, no computers or anything. It was just mechanics, but it allowed the daughter to hold a glass or hold a ball or hold onto her bicycle, and just sort of a grassroots thing. And that turned into a worldwide project because it was easily customizable to different children, and as they grew, they could change them. There were Cub Scout troops, there were high school science teams building these things for children in their community worldwide. And
amazing.
It was just very cool.
That's really cool. What do you remember what the very first product you ever wrote about was?
No. It was 3,500 ago.
I know. I was just curious.
I could look
Maybe
it up.
You remembered.
Yeah.
No.
But
I'm sure I could look it up too.
But yeah, we covered a whole lot of stuff. But obviously, you talk about health and wellness and technology, very soon you collide with elderly tech, helping people with aging in place issues and supporting caregivers and those kinds of issues. And so, it wasn't the major part, but it was certainly a significant part of the kinds of products that we covered.
We'll be right back.
Quick pause. Are you caring for a loved one? Recharge inside the Aging Together Caregiver Hub, our free online community packed with expert tips, live Q&As, and peers who truly get it. Join in seconds at aging-together.com, then dive back into the show feeling supported.
Tell me a little bit more about that. What's your connection with, wanting to use health tech to improve specifically, whether it's the quality of life or functionalities for the elderly or their families or their caregivers? What prompted that specific vision or focus into that area?
Part of it was just target of opportunity. Again, covering wearables, here products that are technology enabling ways of solving problems that relate to the elderly and seniors. Within that, though, I saw a huge opportunity, more than opportunity, a strong need. If you look, I'm sure you're familiar with the statistics about caregivers in this country, but the majority are unpaid. Their families or friends or neighbors. The average employee who has caregiving responsibilities for someone other than a child, they spend on average 20 hours a week in caregiving related duties. And that's on top of a full-time job. So, they've got two jobs, one of which they don't even get paid for. And so we need all kinds, and even when they're working, a lot of times caregivers are not fully present because they're thinking, I hope mom hasn't fallen. Is she getting her food? Is she going to the bathroom like she should? Is she moving about? And being concerned about those things, it's sort of in the back of your mind, and it's always nagging. So for me, technology has the ability to take away some of that stress, to take some of that burden on and automate it for you so you don't have to worry, have they taken their meds today? Are they going to make, when do they have next appointment, and those kinds of issues. So for me, it was a bit of a passion project because the need is so great, and it's just not sustainable for a lot of these people to try to. I mean, I don't remember the statistics, but it's just stunning how many full-time workers reduce their hours of work or quit the job market entirely because of responsibilities for taking care of someone else. And unfortunately, the bulk of that falls on women. And so we're losing some really valuable resources in our business community because we can't provide enough support for caregivers.
Yeah, those who listen to this show or follow me on my many channels know that I talk about this endlessly. And, I'm constantly trying to find ways to help support primarily these female working caregivers who are often also juggling parenting. And so that sandwiched generation and how to best support them as they're navigating dual roles on top of their jobs. And you're absolutely right. It's astonishing how many gaps there are that need to be filled. And so that's awesome that you were able to find that need. And, I don't mean to date you, but you're talking about this issue coming up decades ago, and it's still very much of an issue, and it's actually exacerbated significantly, exponentially, right?
Absolutely.
Just with the rise in how many individuals are living longer, but a lot of those who are living longer right now are living in illness, not necessarily wellness. And, caregivers are, at the heights of their careers or even, later years, or they're retired and they're taking care of their family members, right? Yeah. So
Yeah.
it's a
Yeah.
lot.
And it's the aging population. There are more of us than there are of you than there used to be. The U.S. It's true here in the U.S. In some countries like Japan, it's dramatically worse. I mean, the portion of their population that's aging out and requiring services, and so they've got a whole lot of social and political and business issues that make that problem worse. But we have that here too. The diverging income levels, the top and the bottom are splitting, and so a lot of people have fewer resources available to help them with supporting their aging parents or loved ones. And I should add that it's also personal for me. I'm fortunate enough that my mother is still alive. She's 104, and she lives by herself in a single-family home with no immediate neighbors. And so, and I've been responsible for her health and a lot of supporting her, which I do from 6 hours away. Certainly technology has something that I've turned to, but I feel that I'm very fortunate in that I understand a lot of this, and in doing HealthTech Insider, I was in a position to be aware of a lot of things, and it just drives home to me how little information is available to families, how hard it is to find what's out there and to understand what's good or what's not. For example, there are a lot of products aimed at aging in place issues, and they require a smartphone in the house in order for them to work. For me, that's a non-starter. 80, 85, yeah, you could probably keep your phone charged. You can probably keep it updated. Probably can know how to use it, but you get much beyond that, and it's a challenge. People need simpler interfaces and more reliable things. And for me, as the caregiver, I certainly want my mother to be involved in her, expressing her needs, but I also don't want it to be the only channel. I want some things to be that will notify me whether she wants to or not. I want some things to be automated, and so it gets complicated very quickly. And again, it's hard for a lot of people to know where to turn to find this information, because there are very few people who are in a position to objectively discuss the differences between products in a certain category.
Yeah. And there's just so many on the market. And if you try to cross compare them, to a lay eye, you don't really know. Most people are going to go with the cheapest option, as long as it has the functions that they want. And at other times, maybe someone who can afford it goes for the most expensive option. But I've learned in my years that oftentimes the most expensive options are the least functional.
They can be.
And that goes from everything from like kitchen gadgets to other home gadgets to, just everything. But you need a place where people who know the industry or know the options can match people with the appropriate tools, right? We do that a lot in occupational therapy, as I'm sure you might be aware. We're looking at their function and we're seeing what they really need and then making suggestions as needed that are appropriate for that single person. But even then, there's just so many choices, which is a good and a bad thing, I think, for some things.
Well, you really hit the nail on the head, I think. when you said we start with the need. And that to me is the key, because a lot of people say, just give me the solution. Well, I can't solve your problem till I know what it is. And I love to say that, there's no one size fits all solution. Just the simple thing about tracking activity in the home. One family, you're not putting a camera in my house. I don't want you spying on me. Another family, oh, great. I'd love to have you be able to look in on me and see me and what I'm doing. It would make me feel, it would give me comfort to know that, you can watch over me. So, similar problems, very different solutions because of the circumstances and what's going to work or not work for that family. Years and years and years ago, when this aging in place issues started to crop up for me and my mother, I said to her, okay, so one of the questions was, well, if you should fall, if you should be incapacitated for some reason, how long would you want to wait before somebody knew? And she said, 2 or 3 days. Needless to say, this was not an acceptable answer, and I did not build a solution around that.
Yikes.
Yikes.
Oh my gosh.
She's a bit of a crusty Yankee type, so fiercely independent does not even begin to cover it. But but we managed to settle on some solutions. Early on there were far fewer choices. And one of the things that I settled on early on was a device that detects leaks in your house, in your plumbing system. Because you could attach it to the water system anywhere in the house, and it would learn the different devices on the plumbing system. So it would say, oh, that's the kitchen sink. Oh, that's the upstairs toilet. Oh, that's the washing machine. And so I could look at the log and see which part of the house she was using at which point during the day. And if she wasn't doing anything, then I would know to contact her, or, follow up and see what was going on. But back then, that was one of the best options. And that wasn't even marketed as a senior support product.
No, I'm not sure that I would have thought of that, but that's a great discreet way to, one, maintain her independence, and then two, you still having some sort of comfort in knowing that you have a way to know whether she's been active or not.
Right. And so, I was fortunate. I had the technology background, and I had this natural kind of creative bent to not necessarily use tools the way they were intended. So
that's great.
But it worked. But now we use a system where there are cameras in the home, but they don't show images of the person. It reduces them to stick figures.
Yes.
And so, I can check her. It records motion throughout the day, so I can check her, morning and night, make sure that she's getting up, that she's going to bed, and that things are working out. But it also does automatic fall detection. So if it sees behavior that it thinks is, maybe somebody on the floor or, whatever, I'll get an alert on my phone, and I can go look and, if necessary, follow up. But but so there's a camera, but I'm not seeing her as she's moving about. And it also means that when somebody else is in the home, I can tell because they have a different gait, different size. I can tell very easily that it's that she has company.
Yeah, someone else in the HealthTech space, she's actually building out a directory of HealthTech tools, and she just recently educated me on the stick figure camera, and I thought that was so cool. And what a great option for those people who don't want to be on camera. I think you shed light on a couple of these things already, and we talked about it, but so often health tech focuses on the data and sensors and metrics, and coming from a healthcare background, I understand that we need that stuff for better research, to develop better products and, make sure they're working as we want them to. But in all of that, it misses a lot of that, excuse me, what we were saying of like independence and dignity and all of that. How can we ensure, or those who work in health tech development, ensure that technology also supports individuals' dignity, empathy, and like the human touch, especially for these aging adults who want to maintain that sense of independence?
I'll start with a story.
Yeah.
15 years ago, we had some friends over for dinner, and one of the husbands was clearly upset about something. And I said, what's the matter? He says, well, I went and had my annual physical today. I said, okay. He said, and I brought 12 pages of data from my Fitbit, and my doctor didn't even look at them. And of course he didn't, because those 12 pages didn't tell him anything that he needed to know. And I think we're now beginning to get past the phase where we have products designed by engineers for engineers instead of products designed for families. If you just start with, give me the data. Data is not information. Data is just numbers.
Mm-hmm.
Give me information. The person in the home hasn't moved in 2 hours. They've been in the same place for 2 hours. Maybe, that might be something that needs attention. It looks like the person's on the floor, or the person hasn't opened the refrigerator today. And so just giving me a log of the refrigerator door opening and closing is helpful. But what's more helpful is for a system that learns what normal is and then says, hey, something's out of normal. And can bring its attention. And this, fortunately, AI artificial intelligence is giving us a whole new set of tools for this. Because one of the things that some types of artificial intelligence are really good at is taking a huge amount of data. And something that would be difficult for any individual person to wrap their head around. But they can take that whole thing, find the patterns, find the pieces that match up or don't match up, and say, oh, here's something that maybe needs attention. And so we're seeing that from, as I mentioned, fall detection. Another huge one is medication adherence. Mm-hmm. I mean, I take fistfuls of pills twice a day. And if I miss a dose, probably not bad, but if I miss a bunch, it's going to raise my risk of having adverse, events happen as far as my health goes. And so, have you taken your pills this morning? Do you know you've already taken them? Don't take them again. And there's all kinds of systems that are built in to help people monitor that. I mean, there are some that are just as simple as a smart pill box. And then that goes up to some very impressive kinds of tools that will identify the person who's in front and deliver the medications that are due, at that point, and then confirm that they've taken them. Oddly enough, a lot of this has grown out of some of the substance abuse treatment programs where the patients enrolled in those programs are required to take their medication on time, and then they're not giving it away to somebody else or something like that. And so that is a lot of that kind of technology has spilled over to the age tech area.
Yeah.
And because seniors not taking their pills is a billions and billions of dollars problem in this country. A whole lot of conditions, complications are avoidable if they only took the medication as prescribed. It's not a trivial problem.
No, definitely not. And it's a big point of, concern that we generally address whenever someone ends up in the hospital before they go home is, are you going to be able to manage your medications? Because oftentimes that and falls are the highest risk of readmissions, right? And so making sure that, one, people understand what medications they take and why they take them and what the adverse effects of not taking them could be. And then two, all the social drivers, do you have access to it? Can you afford them? Can someone pick them up for you? Do you have a doctor overseeing it? All those other parts to it too. But if there's technology that can help minimize even some of that load on the system or on the person or the family, then that could exponentially improve their chances for adherence.
And another thing about artificial intelligence is that I think that it gives us the opportunity to deal with comorbidities much better than your typical healthcare professional can. Comorbidities mean multiple chronic conditions. So you might be overweight, you might be hypertensive, high blood pressure, you might be diabetic. You can't focus on any one of those three without paying attention to the other two, because they all interact and affect your overall health. One area, remote patient monitoring. You talk about hospital discharge. Readmitting a patient to the hospital is extremely expensive for the hospital and everybody involved, and something that patients don't particularly like doing. But so if we can monitor the patient once they've been discharged to head off any complications that might be arising before they become critical. One of my favorite examples is in heart failure, chronic congestive heart failure. Basically, your body doesn't process fluids properly, and so they can accumulate. And you gain a little weight, then your ankles get swollen, things get better, and then ultimately you start getting fluid in your lungs, and you've got an emergency ride in an ambulance and a readmission at the hospital. If when those first few pounds were gained, somebody was aware of it, and a nurse could come out, check you, maybe adjust your meds, the rest would never happen. Mm-hmm. And that's an example for me about how simple technology, just a smart weight scale that reports to a dashboard to somebody, family member, healthcare professional, whatever, that could avoid that whole problem for that specific kind of situation. And it's not an expensive solution.
Yeah. Similar to that, actually, I went to an expo yesterday that's happening here locally in the rehab medicine world. And one of the vendors was, I don't remember their company name right now, but their product is a similar like respiratory wearable where it monitors people with COPD and asthma or other respiratory dysfunction. It monitors their lung sounds. It's essentially like a pacemaker, but instead of internal pacemaker, it's an external wearable that you wear somewhere on your torso, and it monitors like lung sounds and different, listens to your lungs essentially like a stethoscope would. And it provides information on if the rhythms or the sounds are going to lead to an exacerbation before the exacerbation happens, so that someone could intervene earlier and not lead to an exacerbation that would land them in the hospital. And I think that is one of the best ways to use a lot of these proactive preventative wearables.
So the Oura smart ring?
Yeah. Mm-hmm.
Right? A lot of people don't realize this. During the pandemic, the COVID pandemic, the NBA issued them to all their players because they found that there were certain biometric results that were precursors to a full-blown infection. And so that they were able to identify players before they got sick, so that they get treated and isolated and all that. You talk about the patches that for sound and listening to the lungs. There's a whole lot of very interesting technology that's coming out based on sound, but to listen to the heart. So most of we get EKGs or ECGs, And those are based on electrical signals because muscles use electricity to signal the need to beat. But they're discovering that by using sound to monitor heart activity, they're finding out all kinds of other information that's much richer and more useful than just the electrical information. And so these smart patches that people are able to wear now, they're just going to get more and more sophisticated. You'll be able to wear them for longer, and they'll be able to provide more and more information. And already we're beginning to see some of that woven into textiles and become clothing, which is, I've always loved to say that wearable technology will succeed when it disappears. All right. If you have to think about it, if you have to remember to charge your watch every night, if put something on, you're not going to do it. Eventually, it's just going to be too much of a bother, and it's going to end up in a drawer. But you put your shirt on, and that's part of what you do every day. And if your shirt tracks your health, that's a win for everybody. And you just don't even have to think about it.
Yeah, that's really interesting. And it is partially like what I'm really excited to see as this continues to evolve and grow with the add-ons of artificial intelligence. Something we touched on a little earlier, many of our listeners are family caregivers who are navigating both the emotional and the logistical challenges that come with caregiving. In your view, what is the most overlooked way that technology can lighten their load?
I think the monitoring is the big one. And again, what are you monitoring? Well, it depends on the individual. Is it fall detection? Is it medication adherence? Is it diet? Is it, what's the piece that's most concerning to you? Is it leaving the home? Maybe there's some cognitive decline involved. And so you want to know if they leave the home, or you want to have some geofencing or geo-tracking to know where they are, so that, again, no one size fits all, but there are solutions that will help ease that burden of having to be constantly aware, that will watch for you and let you know when you're needed, your attention's needed. And I think it's like chronic pain. Chronic pain, people say, well, I can tough through it, but they don't realize just how exhausting mentally and physically it is to have chronic pain. And it's the same with stress. That chronic stress will wear you down. And anything you can do to relieve that stress is going to be a benefit. And, you can't take care of somebody else if you can't take care of yourself. So
yeah, you can't pour from an empty cup, right?
Exactly. So find the thing that you're worried about and see if there isn't some way to worry about it less. In France, a number of years ago, they came up with an absolutely brilliant service. As in this country, the Postal Service was losing business. Just weren't that many pieces of mail being sent. And yet the mail carriers had to go their routes every day and go to all the houses anyway. They came up with this idea of providing a service where they would check in on the elderly as they made their rounds. And so they got paid to make the stop and have a cup of tea, or just make do a wellness check that they're there and they're okay. And emotionally, it's great for the senior because it's outside contact and something to look forward to every day. It was more revenue for the company, for the Postal Service. It's sort of one of those win-win things. So there's a lot of room for creative solutions here. We just need to be open to them. And I love the fact that your friend is putting together a resource about this, because there is no good place to go. I mean, there's some services that focus on seniors, but a lot of them tend to be marketing programs in the guise of something else, and with good intentions. But you're not going to necessarily get the full picture or a fully objective picture of what's available.
Yeah.
Because they may have an interest in you choosing one product or another.
Right. Well, and that's, across the system, across the industry, there's a lot of these, not necessarily kickback programs, but they're like, they're partnership programs where, it's, if you're, whether it's a directory or you're marketing or you're getting paid to sell a certain product, then it's no longer necessarily what the client needs. It's what's making you money. Right. And it's two sides of the industry. There's the side that fully operates on that side, and then there's the side that struggles because they don't want to opt into that
Exactly.
market, but then it's harder to bring in revenue, right? And so I think, but you're absolutely right in that it becomes really challenging to get recommendations.
Be careful who you listen to. Understand which side of the bread the butter's on.
Yep. And transparency. I think that's been that's one of the best improvements I've seen across the industry, and just I think generationally in the workforce is the transparency of information. And I, for one, fully support it because I think consumers should know what they're buying and who they're buying from and who benefits from it. And I think that's incredibly important.
And that leads me to one of my hobby horses, which is I feel that employers have a responsibility and an interest in helping support the caregivers in their employ. All right, they're going to reduce absenteeism. They're going to have people more present. If they're not distracted by their responsibilities, they're not going to be cutting their hours or quitting their job. And if at the very least, employers could make information readily available to these people. Here are places you can go. Here are the public services, nursing, public nursing or whatever the local resources are that might be available. At the very least, I think that the smart employer would subsidize that in-home monitor, that smart weight scale, that blood pressure, the wearable glucose monitor, that they would subsidize those because it's going to free up the employee to do a better job. And there's also, some employee loyalty that will come from that because they're being helped out. So if there are any employers listening on this, I would encourage you to think about what your policy is towards these, 40% of your employees probably who have some caregiving responsibilities, and what more can you do for them?
I agree. I have started seeing a gradual increase in employee assistant programs who have started incorporating caregiving resources. And I applaud the ones who started doing it earlier rather than later. But now, yes, I absolutely agree with you. I think every employer should be considering adding these sorts of resources, and then also, cost sharing or supplementing their ability to be able to utilize and access that stuff. Moving back to tech, and something we mentioned earlier is that these devices and apps are becoming more and more advanced. Mm-hmm. How do we prevent this growing digital divide that seems to be happening, especially for these older adults and families who have limited tech literacy?
Wow. We got another couple days. So one of the touchstone points about this in this discussion is the fact that NIH has identified broadband access as a social determinant of health. Now, social determinant of health is shorthand in the healthcare industry, but what it means is these are factors like access to fresh food, like a warm home, air conditioning, a stable resident, living situation. These are all social determinants of health, and broadband access is right up there with the rest of them, with food and shelter. Mm-hmm. And we don't act on that enough. In fact, we go the other direction. There have been federal programs approved by Congress to expand internet broadband access to more communities, the underserved communities. Those programs have been canceled. The money has been pulled back. We're moving in exactly the wrong direction. And it's so short-sighted because you can't do the remote patient monitoring. You can't do telehealth. You can't do these things that make people safer, that make people healthier, they find about disease before it happens. You can't do those without the broadband. And so when you don't have that, these people are going to get sicker, and they're going to show up at the emergency room, and they're going to end up being an admission when they didn't have to be, and it's going to cost everybody. I mean, even if you don't have an elderly family member, if you pay anything with healthcare insurance or Medicare or any of those things, your costs will go up because more people are getting sicker, and those costs have to be covered somewhere. So for me, it starts with that broadband, to make sure that more families have access to it and the kinds of services that it makes possible. But that's just the tip of the iceberg, obviously. You need to have the funds to be able to have some sort of computer or tablet in the home. You need to be able to know how to use it and maintain it. It gets complicated very quickly, but yeah, there's a lot we need to do to raise up those who are underserved with digital technology, with health technology in general. Bring them up so that they can take advantage of it.
Yeah, you're absolutely right. And I love that you started with just even access to a broadband connection. I mean, I think that can then stepladder towards other things, right? Like I'm seeing an increase in tech literacy education classes for elders, or even just access to like a computer lab, or, just educational sessions and things like that. But if they don't even have access to that from their home, how do they learn? How can they get be more informed about it? There's a lot of layers to that.
And another big social determinant of health is isolation, engagement with others. And many of seniors have mobility challenges, either their own individual personal physical mobility, or they may not be able to drive any longer. It may not be easy for them to use public transit, or it may not be available to them in a reasonable way. And so they get isolated. Well, to be very honest, I would not have come to Chicago to sit with you and do this interview. But the broadband, the telecommunications makes that possible. And seniors can use this to connect with others. My mother has a regular Scrabble game that she plays with somebody down here in Philadelphia. They do it by Zoom. They worked out a way to play Scrabble together over Zoom. And that's something that she loves and looks forward to. She also used to travel a lot. She loved to travel. That's no longer an option for her. But she goes all over the world on her computer. Visits Rome, tours the museums. That's all these things that you would not be able to do in the same way were it not for the internet and the communications that we have available.
Yeah, I love that.
Without great technical skills required either. And it's going to get better. I mean, for over a decade, there have been fabulous programs using virtual reality. You can now, wearing virtual reality goggles, go on a live tour of cities around the world with other people and a live tour guide walking the streets. So you're going with them, and you can talk to everybody, and you can talk to the tour guide as they show you things around the city, and you can look around and see what's there, without leaving your recliner. It's that kind of thing that's going to make people healthier, because they're going to be engaged. They have something to look forward to. They have something to look back on that they enjoyed. something to talk about to others. There's that's a big piece of the health too.
Yeah, and it keeps them cognitively stimulated too, right?
Yeah.
Yeah. You mentioned remote monitoring systems earlier, and you might be partial to that answer for this too. But what is one tech tool or category of tech options, whether it's wearable, home sensors, communication platforms, but one that you think that every caregiver or family should at least know about in 2025?
Fall detection, flat out, number one, because like you say, it's the leading cause. It's a leading precursor to so many other problems for the elderly.
Mm-hmm.
And it's not entirely avoidable, but a faster response is going to mitigate the negative impact of it. The point that caregivers should take home, however, is that it does not have to be the stupid pendant that most elderly don't want to wear. I mean, the help I've fallen and I can't get up pendant, a lot of seniors won't wear it. And I mean, some happily will. My mother wears one now. That's fine. But with her, for some people, they don't want to do it. But for me, I get it. It's kind of like the kindergartner who goes to school with a note pinned on their sweater for the teacher, right? It is broadcasting your lack of agency. And the thing that a lot of caregivers don't realize is there are many products out there that can do fall detection in the home that don't have to be worn. And, they can be little beacons. They can, in the case that we're using, cameras, but you can have these things placed around the home that will be able to detect falls without having to wear anything and without having to remember to keep the batteries charged, without, any of those things. The one thing that I would encourage caregivers to keep in mind is to have some facility for automatic detection. I'm all in favor of the panic button. If you need assistance, have a button that you can push to summon help. But again, if they've fallen, there have been studies about this. There's a study where a group of seniors had access to a personal emergency response system, a panic button that they could hit or whatever. And they found that of those who were in circumstances where they truly needed assistance, would you care to guess what percentage of them actually pushed the button?
10, 15,
7%. Less than 1 out of 10 would push the button. And I don't blame them. I've done something stupid. I'm embarrassed. It's not so bad. If I just sit here a while, I'll be okay. And I won't need help. My kids will be angry if I fall, and they're going to want me to move to a care facility. I mean, there's a lot of good reasons not to do it. As the caregiver, I understand those motivations, and I don't care. If you fall, I want to know, because that's something I need to know. And so make sure that there's some sort of automatic detection independent of the wearer.
Yeah, that's a great point. And I've done a lot of work in fall prevention and fall education.
I bet you do. Throw rugs.
Those dang rugs.
Yep.
They have, similar to what you're talking about, they have like motion sensor mats now that look like rugs or carpeting. And there's a lot of neat technology that can be environmental and not necessarily have to be on the person if that is something that they're sensitive to. I'm just looking at the time and I can't believe it's already almost been an hour. I know we can probably talk for a whole nother hour. But in all your years of going through these technologies and working with people and, working with your mom yourself, is there a specific moment or a story where you saw that a specific piece of technology genuinely transformed someone's health, independence, or caregiving experience?
Well, looking at my mother's case, the internet access has kept her engaged and doing stuff. She corresponds with all kinds of people and gets pictures of her great grandchildren, and I think that that's sort of a sleeper effect. But I know that, within that, the various technologies that we've settled on over the years as her needs have changed, that in-home monitoring has given me peace of mind, which in turn gives her peace of mind. She knows that somebody's watching, that she knows that, if something happens, somebody will notice. And so, I would, again, everybody's different. Everybody's needs are different. There's no one size fits all, but I think some form of in-home monitoring, depending on what the elderly person's needs are, I think can be helpful for everybody.
Yeah, that's awesome. If you could wave a magic policy wand, what systemic change would most improve how technology supports aging adults and family caregivers?
Broadband in every home. I would make information about age tech more widely available and reliable, accurate, objective information more widely available and broadcast so that people know it's there, know where to go find it. Because, you don't need it until you need it, and then you don't know where to find it, and you haven't been looking for it. It's so nobody's born knowing how to take care of an elderly parent. And so we need to make that information in big capital letters in people's lives so that they know where to find the help when they need it.
Yeah. And along those same lines, with so many options, a lot of people might feel overwhelmed, especially at the pace of innovation today. So what's one simple first step that they can take today or tomorrow to start integrating technology into their caregiving routine?
So for me, the first step of everywhere, out of all this stuff, is ask the questions. Have the talk. What are you worried about? What am I worried about? What do we need to watch out for? What do you want? It's the same as end of life stuff, same as advanced directive stuff. What do you want me to do? What do you want me not to do? But how do we work this out so that we're both comfortable with a solution? That narrows the field, right? Maybe all we need is fall detection. Maybe all we need is medication adherence. You don't have to look at anything else. You can focus just on that and say, what solutions are there out there that will solve this problem that we have now? And worry about the other ones as they come along.
Yeah. Yeah. Asking the right questions is definitely the best way to start, because then they'll be more open to sharing what the needs are, which then can guide what tools we're encouraging.
There's nothing worse than solving the problem that doesn't need to be solved.
Yep.
And missing the one that does.
Mm-hmm. Before we wrap up, what is one message or takeaway that you hope every viewer takes away from here about the role of technology in supporting healthy aging and caregiving?
You're not alone. You're not alone in being confused. You're not alone in your needs. And you're not alone in the people who there are solutions for. It'll take a little effort. Take a little research. It's not as easy to find the answers as it should be, but know that everybody's different in their own way, but the problems are very similar. And so know that these are problems that have been solved before, and that there's help there for you.
Yeah. Well, Alfred, thank you so much for coming on the show today and talking with me about all of this.
My pleasure. I hope it helps.
Absolutely. I think it was a fantastic review of a whole lot of different types of tools and options that are available, and hopefully urges even one person to start researching things before they actually need them. So thank you so much.
Well, thank you. And thank you for all you do for your audience. I think it's wonderful.
Absolutely. Thank you for listening to the Aging Together podcast. This episode was produced by me, Dr. Pooja A. Patel, in partnership with Natural Eye Media and is supported by our Season 4 sponsor, Safety Grip by Heart Mobility. To learn more about them, check out our Sponsor Spotlight episode. If today's conversation helped you, please follow the show, share it with a friend, and leave a quick rating or review. Your support keeps the podcast free, ad-light, and growing. Want more? Join our live sessions every other Wednesday and unlock the subscriber-only audio replays through the link in the show notes. Until next time, let's keep learning and aging together. Take care.
Aging, illness, and injury can make the simplest movements feel daunting. That's why Safety Grip was designed with compassion at its core. Its deep, textured surface offers real control, especially for hands weakened by arthritis, neuropathy, or stroke, helping restore not just safety, but dignity. Because when you or someone you love needs support, it should feel like someone's there to help. Visit heartmobility.com to learn more.